Hantavirus Pulmonary Syndrome, or HPS, is a serious respiratory disease. It is caused by viruses called hantaviruses. These viruses are found in rodents, and deer mice are the main carriers in the United States. HPS is rare, but it can be deadly. Knowing the symptoms and how to prevent it is important. Early diagnosis and treatment are key. This essay will discuss the symptoms, causes, and prevention of HPS. This will help you stay informed and protect yourself. The early symptoms of HPS are often flu-like. You might experience fever, muscle aches, and fatigue. Headaches are also common, along with dizziness and chills. These symptoms usually appear within 1 to 5 weeks after exposure to the virus. As the illness progresses, you may have trouble breathing. Your lungs may fill with fluid. This leads to severe respiratory distress. It's crucial to seek immediate medical attention if your symptoms worsen. Early diagnosis can be life-saving. Hantavirus Pulmonary Syndrome is primarily spread by rodents. Deer mice are the main carriers in North America. Other rodents like cotton rats and rice rats can also carry the virus. These rodents shed the virus in their droppings, urine, and saliva. Humans can become infected by inhaling dust contaminated with these infected rodent excretions. The virus becomes airborne when these dried materials are disturbed. This can happen during cleaning or when rodents are present in living spaces. Airborne transmission is the most common way people get HPS. When rodent droppings, urine, or saliva dry, tiny virus particles become airborne. You can't see these particles. They can easily be inhaled without you even knowing it. Activities like cleaning, sweeping, or vacuuming in rodent-infested areas can stir up these particles. Simply being in a place where infected rodents have been can also pose a risk. This is why prevention is so crucial. Section 5. Protecting yourself. Effective prevention measures. In this section, we will discuss various strategies to protect yourself and your loved ones from the dangers of Hantavirus Pulmonary Syndrome, commonly known as HPS. By following these guidelines, you can significantly reduce the risk of exposure and ensure a safer living environment. Preventing exposure to rodents is the best way to avoid HPS. Rodents, particularly deer mice, are the primary carriers of the virus. They can enter your home through small openings and contaminate surfaces with their droppings, urine, and saliva. Therefore, it is crucial to take proactive measures to keep them out. Seal up any holes or cracks in your home where rodents could enter. Inspect your home thoroughly, paying close attention to areas around doors, windows, and the foundation. Use materials like steel wool, caulk, or cement to block these entry points effectively. Store food in airtight containers. Rodents are attracted to food sources, so keeping your food sealed and stored properly can deter them from entering your home. This includes pet food and birdseed, which should also be kept in rodent-proof containers. Keep your living spaces clean and free of clutter. Regular cleaning reduces hiding spots for rodents and makes your home less inviting to them. Vacuum and dust frequently, and ensure that garbage is disposed of properly and promptly. This makes it less appealing for rodents. A tidy home with minimal clutter provides fewer opportunities for rodents to nest and thrive. Organize storage areas and keep items off the floor whenever possible. When cleaning up rodent droppings or urine, wear protective gear. This is essential to avoid direct contact with the virus. Protective gear includes gloves, a mask, and sometimes even goggles to prevent inhalation or contact with contaminated particles. This includes gloves and a mask. Ventilate the area well. Open windows and doors to allow fresh air to circulate, which helps to disperse any airborne particles that may be present. Don't sweep or vacuum dry droppings. Sweeping or vacuuming can stir up dust and particles, increasing the risk of inhaling the virus. Instead, take a safer approach to cleaning. Instead, spray them with a disinfectant solution before cleaning. Use a disinfectant that is effective against viruses, and let it sit for a few minutes to ensure that it kills any pathogens. Then, carefully wipe up the droppings with a paper towel or disposable cloth and dispose of them in a sealed plastic bag. Section 6. Safe cleaning practices in rodent-infested areas. In this section, we will guide you through the essential steps to ensure your safety while cleaning areas that have been infested by rodents. Rodents can carry harmful viruses and bacteria, so it's crucial to follow these practices meticulously. If you must clean an area where rodents have been, do it safely. Always be aware of the potential health risks involved. Rodent droppings, urine, and nesting materials can harbor dangerous pathogens. Ventilate the area for at least 30 minutes before starting. Open all windows and doors to allow fresh air to circulate. This helps to reduce the concentration of airborne particles that may contain viruses. Wear rubber or latex gloves and an N95 respirator mask. These protective items are essential. The gloves will protect your hands from direct contact with contaminated surfaces, while the mask will prevent you from inhaling harmful particles. These will protect you from inhaling virus particles. It's important to ensure that your mask fits snugly and that your gloves are intact without any tears or holes. Instead of sweeping or vacuuming, which can aerosolize the virus, use a wet cleaning method. Sweeping and vacuuming can stir up dust and particles, making them airborne and increasing the risk of inhalation. Mix a bleach solution, 1 part bleach to 10 parts water, and spray it on the droppings. This solution is effective in killing viruses and bacteria. Make sure to mix it well and use it generously on all contaminated areas. Let it sit for 10 minutes before wiping up with paper towels. This waiting period allows the bleach solution to effectively disinfect the area. After 10 minutes, carefully wipe up the droppings and dispose of the paper towels in a sealed plastic bag. By following these steps, you can significantly reduce the risk of exposure to harmful pathogens while cleaning rodent-infested areas. Always prioritize your safety and take the necessary precautions to protect yourself and others. Section 7. Recognizing the signs of rodent infestation. Understanding the early signs of a rodent infestation is crucial for maintaining a healthy and safe living environment. Rodents can carry diseases and cause significant damage to your property. Being aware of the signs of rodent infestation can help you take early action. Early detection can prevent the problem from escalating and save you from costly repairs and health risks. Look for droppings, especially around food sources or nesting areas. Rodent droppings are small, dark, and pellet-shaped, often found in cupboards, pantries, and other areas where food is stored. Gnaw marks on food packages, wiring, or furniture are also telltale signs. Rodents need to gnaw constantly to keep their teeth sharp, and this behavior can lead to damaged food packaging, chewed electrical wires, and ruined furniture. You might also notice tracks or footprints. These can be found in dusty areas or along baseboards. Rodent tracks are typically small and can be identified by their distinctive pattern. Rodents are often active at night, so listen for any unusual noises. Scratching, scurrying, or squeaking sounds in the walls, attic, or under the floorboards can indicate rodent activity. If you suspect an infestation, contact a pest control professional. They have the expertise and tools to assess the situation accurately and recommend the best course of action. They can help eliminate the rodents safely. Professional pest control services can provide long-term solutions to prevent future infestations, ensuring your home remains rodent-free and your family stays healthy. Section 8. What to do if you suspect hantavirus exposure. If you think you've been exposed to hantavirus, contact your doctor immediately. Tell them about your possible exposure and any symptoms. Early diagnosis is important for better outcomes. Your doctor will ask about your activities and any potential rodent contact. They may order blood tests to confirm the diagnosis. While there is no specific treatment for HPS, early supportive care can improve your chances of recovery. Section 9. Seeking medical attention, early diagnosis and treatment. Early diagnosis and treatment are essential for managing HPS. If you experience severe symptoms such as difficulty breathing, seek immediate medical attention. Hospitalization may be necessary, especially for respiratory support. Treatment for HPS focuses on relieving symptoms and supporting lung function. Oxygen therapy, mechanical ventilation, and intravenous fluids are common interventions. Antiviral medications may be used in some cases. Section 10. The importance of public awareness and education. Raising public awareness about HPS is crucial for prevention. Educating communities about the risks, symptoms, and preventive measures can significantly reduce the incidence of this serious disease. Public health campaigns, educational materials, and community outreach programs can all contribute to a more informed and proactive approach to HPS prevention. Section 11. Conclusion. Your health is your priority. Hantavirus Pulmonary Syndrome is a rare but serious disease. Understanding the causes, symptoms, and prevention measures is vital for protecting yourself and your loved ones. Rodent control and safe cleaning practices are paramount in preventing HPS. Remember, your health is your priority. Stay informed, take precautions, and consult your healthcare provider or the Centers for Disease Control and Prevention at cdc.gov for more information. Be proactive, stay safe, and prioritize your well-being.